Answering the Good Doctor here, questions about COVID and the vaccines. And our first question comes from Paige, who writes, my kids are all teenagers, ages 13 to 17. They're wondering if and when they'll need a booster.
So no, boosters are not yet recommended for teens younger than 18. They are recommended for teens 18 and older if they have underlying conditions that put them at risk of severe COVID, or they work or live in high-risk settings. But boosters for teenagers might be recommended at some point in the future when there is more data on breakthrough infections and hospitalizations in this age group. So we'll keep you posted.
Okay, this question comes from Anne, who writes, I'm 83 years old, fully vaccinated, and had a booster. My 5-year-old great-granddaughter had her first COVID-19 vaccine, but was exposed in daycare. How long should I stay away from her?
Yeah, I'm hearing this with some regularity, but I'm so glad that your granddaughter, your great-granddaughter, actually got her first shot. That's great news. But since she's not fully vaccinated and got exposed, I would try to limit your contact with her as much as possible. You should avoid close contact with her for 14 days after her exposure, because that's how long it can take for symptoms to show up, although the average time to symptom onset is about 5 days. If you do see her in person, just make sure you both wear masks around one another.
Okay, good advice as always, Doctor. Thank you. Dr. Mallika offers her best advice, but as always, consult your personal doctor before you make any decisions about your health. And if you have a question for Dr. Mallika, you can reach her one of 3 ways, starting with email, drmallika@cbs.com. You can reach out to her on Twitter @Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall. David?
Lisa, Dr.